Our current Secretary of Health just 3 months ago went into a conference and surprisingly didn't talk about vaccines or cancer or something like autism or food dyes, but instead plastic. But not any kind of plastic, microplastics. When you think of microplastics, you probably think of the ocean and turtles and fish and saving the environment. Important stuff, sure, but why of any value to be talked about by the Secretary of Health? Well, Kennedy is claiming that there are microplastics inside of you. And not only that, but these plastics, he claims, are causing chronic disease and cancer. Now, a lot of people don't take this guy super serious, given his past and current opinions, but really, microplastics are gonna lead to a lifetime disease and cancer. Even with my inherent skepticism, I wanted to be at least somewhat educated on the topic. And I looked at the data, the research, to figure out the answer to the question. Is there plastic in our blood, like Kennedy claims? And if there's plastic in our blood, is it really going to cause chronic disease and cancer? The results and the effects are not what you're anticipating. So first, I think it's important to make clear that you're not having credit card sized plastic inside of you. I know, crazy, right? You're not gonna have a card like this big flowing around in your blood. Every time you eat with a plastic fork, it's not like one of the edges are just breaking off and dissolving into you. If plastic is going to get into your bloodstream, it's gonna be small, really small, invisible to the eye kind of small. Microplastics can be as small as 0.0007 millimeters. To give you an idea, that is 1/10 the length of a human hair. And you know what? Microplastics of that size have been found inside people's bloodstream. So it is absolutely true that microplastics are inside of our bloodstream. And there were 3 big areas that microplastics were thought to have been able to enter from: breathing, contact with skin, and eating. If those seem pretty impossible to avoid, it's because they are. There is some good news though, because with new research and science coming through, it seems very unlikely that microplastics can enter you through contact. Micro and nanoplastics, as they're called, can still get fairly deep into the skin, but there's not been any recorded evidence of microplastics passing through the skin barrier directly into the bloodstream, except when you have an open wound. However, the evidence for drinking and eating isn't so nice to allow us to just shrug away this whole topic. Microplastics are in our drinking water, whether it's from tap or bottled. The particles can enter from water at the source, during treatment and distribution, or in the case of bottled water, during the packaging process. A recent study commissioned by the Plastic Soup Foundation found microplastics in all blood samples collected from pigs and cows on Dutch farms, showing the near universality of microplastics in the bloodstream of livestock. And while you might think that's not important because we don't eat the blood from animals when we consume beef or pork, of the beef and pork samples collected from the farms and supermarkets as part of the same study, 75% showed presence of microplastics. And then many studies also found that there was microplastics in the muscle of fish, not just the gut. And so when people eat fish, they are also consuming microplastics. On top of that, fertilizers are coated with plastic for controlled release, but plastic mulch film is used as a protective layer for crops and water containing microplastics. In addition, a new study estimates that the average adult consumes approximately 2,000 microplastics per year through salt. So over the course of a lifetime, if you live 80 years, you're going to be consuming around 160,000 microplastics just through salt. And the worst fact is how this is even worse for babies. As from a small study of 6 infants and 10 adults, found that infants had more plastic particles in their feces than adults. A little strange that they found it in feces, but hey, whatever, do what you gotta do for research. And that research suggests that microplastics can enter the fetus through the placenta, and that children can ingest microplastics through breast milk and through using bottles. Recent studies attempting to quantify the levels of human ingestion of microplastics vary dramatically, but they suggest that people are consuming roughly tens of thousands of microplastic particles per year. How all these particles are absorbed, distributed, metabolized, and whether or not they're excreted, and if they are excreted, how long they stay in the body. But now we get to breathing, and breathing is just even worse than eating. Research has found that in indoor areas, concentrations of microplastics range from 3 to 15 particles per cubic meter. But luckily, outdoor concentrations were much, much lower. This is due to the high level of plastic objects within households, with every room having several different plastic objects, which are used as sources for floating microplastics around the air. There was a small study done in England that showed that 11 out of 13 lung tissue samples, microplastics appeared. And then a study in 2018 found that people were ingesting more microplastics through breathing in the air around muscles than from the actual plastics inside of the muscles, which I just think is absolutely bonkers. Immunologist Nikki Veerscoop from the University Medical Center of Utrecht made me sigh when she said, "If I keep a piece of fish on the table for an hour, it probably has gathered more microplastics from the ambient air than it has from the ocean." So as long as you don't eat, breathe, or drink anything, you should be fine. There is no escaping plastic. We all know that there has been plastic found at the deepest part of the ocean, but there has also been plastic found inside glaciers in Antarctica, at the top of Mount Everest, and even space. Yes, there's plastic in space. Even the Martians are not safe from ingesting microplastics. But okay, there's a lot of things around us, like there's a bunch of bacteria inside of our gut, but that stuff's actually good for us. So does microplastics actually have an effect on our person? There are many things that microplastics probably do. There's a problem with making any definitive statements about microplastics just due to how limited the research is. I mean, you heard the sample sizes from all the evidence I said above. They usually range in between 10 to 30 people. So if I make any major mistakes in this video, I'll make sure to correct any mistakes in the pinned comment below. Microplastics are endocrine disruptors, meaning that they behave like hormones in our body, confusing our regulating hormones into thinking that we have too much or too little of a certain hormone, or blocking the effects of hormones. When hormone balance is off, it can lead to fertility issues, blood sugar imbalances, metabolic issues, autoimmune diseases, which is something that the Secretary of Health likes to talk about a lot, growth problems, and much more. Not great to have your hormones off balance. And many experts think that microplastics, along with the chemicals found in plastics, more broadly, are a large reason for the consistent decline of testosterone and sperm in men over the last 50 years, with an average 25-year-old male from 50 years ago having significantly higher levels of both than an average male of 25 today. And the trend is not slowing down, with about a 1% drop every year since the 1970s. This may be a major cause of the recent increase of male fertility issues. Microplastics may indeed cause cancer. Dr. Kuriakose stated that this is purely conjecture, but knowing that microplastics are so small and can land on our cell membranes, they could cause issues with our cells' ability to regenerate healthy new cells. Our cells are constantly regenerating and we're dying 1,000 deaths every day. But because of our genes, we're able to suppress the abnormal, rogue-like, cancer-causing cells. But if microplastics interfere with cell regeneration, it may cause a higher incidence of cancer and other diseases. But the science isn't sold on it yet, because cancer rates for young people are actually increasing and they would have less microplastics in their system, and cancer rates in general have been decreasing since we've been having more microplastics. So there's a lot of different factors going on, so the science isn't sold, but definitely something that should be kept an eye on. And in laboratory tests, microplastics have been shown to damage human cells in a process called oxidative stress, and microplastics may potentially increase the chance of birth defects and alter fetal development. Microplastics may trigger immune responses that can lead to chronic inflammation, which is linked to many diseases, including another reason it may cause cancer, chronic disease, and heart disease. And because these plastics are likely to cause hormonal disruption, inflammation, and oxidative stress, researchers suspect that microplastics may lead to neurodevelopmental issues in children and cognitive impairment or mood disorders. I know this may sound incredibly biased to some of you with the wide-ranging amount of negative things I'm saying. And even though there isn't a pro-microplastic side like there is to many opinions and issues, the data and research, while new and sparse and small, says that microplastics are concerning and may indeed cause cancer and chronic disease, and that we seriously need to do a lot more research into this topic with how large a problem they truly might be. In the original rendition of this video, I had a section here about how we as a society and people can reduce the amount of microplastics in our life. But that's not what this channel is for, and so I removed that so that we can just stick to the facts and figure out, and all of you can make decisions on how you want to use this information. But the data is saying that there is almost certainly microplastics in your blood. Currently, wherever you are in the world, whether you're American or Indian, 15 or 70, rich or poor, you have plastic in your blood. The question is whether this is just a weird fact or the start of a global health crisis. If you found this video useful in any way, please subscribe to help out a small channel and tune in to my library of content I'm starting to build up. But don't forget that the science is small, but is very concerning, and think controversy. I'll see you next time when I hopefully come up on your recommendation page.